Before I forget, I do want to mention that there are opportunities for healthcare interns at DHR, and they put them in all areas. So if they say, I want to do pharmacy, they'll find a place in pharmacy. If they want to do something in the NICU, or if they want to do research. Yeah.
What is that required?
I'm sorry?
What is that required?
So you can just go online at dhrhealth.com, and there's a place there where you can apply for an internship, and then it'll have the entire application.
Like certain age do they have to be, or like do they have to have a certification, or what?
Yeah, we want them to be adults, so usually if they're seniors in their summers, they could apply. We used to have volunteer positions, but with COVID, that's going to be very limited. So the healthcare intern positions are paid for, are paid positions, so again, they're limited. Hopefully, in the near future, we can bring back the volunteer positions. But that is something available so that they can get some experience in the healthcare setting and see if they even like it, right? Sometimes it's like, do I like this or do I not? And they can try it out for a few weeks in the summer and then decide. So up next, we have Dr. Ron Ozuna. Dr. Ozuna currently serves as the Pharmacy Clinical Coordinator at DHR Health and the Assistant Dean for the University of Houston College of Pharmacy-RGV program and Clinical Assistant Professor within the Department of Pharmacy Practice and Translational Research. He graduated with his Bachelor's in Biology from Texas A&M University-College Station in 1994 with his Pharm.D from the University of Texas at Austin College of Pharmacy in 2000. Dr. Ozuna received his board certification in pharmacotherapy in 2009, and he also received certifications in pharmacy-based immunization delivery as well as medication therapy management via APHA. Dr. Ozuna's academic and research interests include infectious disease, critical care, diabetes, and ambulatory care. Please help me and welcome Dr. Ron Ozuna.
All right, good afternoon. Can y'all hear me well? Yeah, all right. It's good to be with you guys this afternoon. It's good to be back in person again, right? I think that's the biggest thing. First and foremost, Monica, thank you for the glamour shot there. That's not the way I really look. This is the way I look. Anyway, if you bear with me for 2 hours, I think it is, Dr. Rao. Do I have 2 hours? Is that what it is? I would say they saved the best for last, but after seeing the speaker panel, that's definitely not true. So we'll begin. I'm Ron Ozuna, as Monica mentioned, and I'm the Pharmacy Clinical Coordinator for DHR Health, also the Assistant Dean for the UH-RGV program. And that's a program that we'll kind of look at here in a little bit to see where pharmacy opportunities lie in the state of Texas, right? But been a pharmacist for 21 years, been with DHR Health for 14, and with the University of Houston for 5, and we just renewed the program again for another 5 years. So we'll talk about those opportunities for your students moving forward. Is this going off on me a little bit? Okay. Before I begin, and I go to the next slide, I want you to just think of the pharmacists that you've encountered in the community. Just think of that person. Everybody has had an encounter with a pharmacist at some point in their life, right? And when you picture that pharmacist as to where they work, the stereotypical picture might look a little something like this. Now, I like the animation. It's not really what they look like, although the animation includes everything in a pharmacy setting except for the chicken. Although we do have to interpret MD orders at times that do look like chicken scratch, right? But I love this animation because it's exactly what a pharmacy is. You have meds in the back, you have your inventory, you have your prescription, you have your counter, you have your point of sale, you have your patient. That patient is important. That patient is the one that we deal with each and every day in multiple settings. And I'm passionate about my career, so I'm going to guide you through the opportunities there that lie for your students, right? To become pharmacists, to become doctors of pharmacy now, all right? So the overview is really, we're going to look at pharmacy settings. Where do pharmacists work? What do they do? We're going to look at an admissions overview, requirements to get there. Can't be a pharmacist unless you study hard. And then we're going to look at employment outlook, what the jobs look like for pharmacists, right? Is there opportunities there to get a return on your investment? And how long is that investment? We'll go through in just a little bit. So when we look at pharmacists and where they work, you can see that there's a slew on this list, right, in terms of opportunities. We have community, the picture that we just showed, working at multiple community service centers, grocery stores, clinics, etc. That's your quick access to the pharmacist in the community. That's your quick access to medication education. Then you have clinical and hospital settings where I work. You have operational and clinical activities that go on there, right? And clinical meaning that you're side by side a physician, you're performing interprofessional practice with doctors, nurses, ancillary departments to make decisions on patients to get them out of the hospital as quickly as possible. And if we don't do that as a team, Dr. Malcolm will be on our you know what, because those metrics aren't being met, right? Next thing is ambulatory. We have ambulatory clinics that house pharmacists now, PharmDs, right? We have 2 at DHR Health, in transplant clinic and our endocrinology clinic. And these PharmDs actually function as patient care providers. They have developed collaborative care agreements with their physicians to be able to prescribe. They can prescribe medications. Pharmacists have evolved from dispensing all the way to prescribing, right? And even in the hospital, my clinical team has the ability to adjust and perform medication therapy management, okay, which is writing orders, carrying out orders, etc. So in the ambulatory clinic, we have those available and pharmacists are housed there. Veterinary, really compounding. So if you look at outpatient community pharmacies, you'll see that some pharmacists are compounding medications. They have to make these meds that are made for humans into medications for animals. And we work side by side veterinarians to do that in the community setting. Academics, which is a part of what I do on a daily basis as well, and that's experiential and curricular academics. I get in the classroom and teach students, about 120 students like this, for the University of Houston, but I also am a clinician for DHR Health. And I train students that come in their 4th year, and I train them on the clinical aspects of pharmacy, how to become a pharmacist. It's that one final year of PharmD curriculum that gets them through and gets them to take their licensing. Clinical research, public health, federal, local governments. There's pharmacists that work for the Texas State Board of Pharmacy. There's pharmacists that work for Joint Commission, which is a regulatory agency that comes in and surveys us every 3 years. Make sure that we're following standards. And informatics. Dr. Malcolm actually talked about informatics. And yeah, pharmacists are in there too. And they're establishing standards and protocols to know exactly how to handle patient care and follow those particular metrics that we're using to improve outcomes. In addition to that, we have the industry, which is the pharmaceutical industry. And there's a bunch of activities and areas of practice where pharmacists can work in the industry. And we're talking these companies that literally make the meds. So there's research and development, quality assurance, quality control, sales and marketing. You see those pharmaceutical reps. Those are educational resources for us on their specific meds, right? So they come in and they educate us on the medication. So they're clinical liaisons that we utilize for education as well. Regulatory, again, we talked about State Board and Joint Commission. And then consulting for long-term care, for nursing homes, things of that sort, where pharmacists are actually involved in their practice. What do they do is the next question. And this is everything that a pharmacist can do, and it's not comprehensive. It's not all-inclusive. There's a lot of other things that I do. I'll mop the floors, I'll throw the trash out, I'll do whatever it takes to make sure that my operations is running smoothly and efficiently. I'll deliver a med to a patient if I have to, right? We do everything under the sun across the board. Main thing here, big piece, is education and consultation. If we want to do anything to impact our patients, not only get the medication to them, but educate them on how to take it. And that's key. And that's key for your students because communication is big, all right? We need to communicate well. We need to educate them well. So we're educators in the clinical practice setting, just like you guys are in the academic setting, okay? Next thing is we're going to go through the pharmacy pathway. We want to know how to get there. We know what they do. We've encountered pharmacists in our community. We want to know how they get there. And this is a critical piece for your students because I get these questions all the time. When I'm going, and some of you guys look familiar, by the way, because we've been in your high schools and we've talked to some of your students in your classrooms, all right? And some of this is new to them. They're unfamiliar with how to get the process going to get into this field. So we're going to look at pharmacy schools in the state. We're going to look at the PharmD program structures that are available. We're going to look at pharmacy. Is pharmacy right for you and the selection process for pharmacy schools? Things that you can hand to your students or ask your students to see if pharmacy is really for them and what pharmacy school is really the best one for them. And then student prep and academic progression, licensing and certification, and advanced training, postgraduate. After you get your doctorate degree, what is there for pharmacists to continue their professional growth? These are the schools in Texas. There's 9 in total, and one of them is private, and that's in San Antonio. That's University of Incarnate Word, right? But you see that we have pharmacies in all the way up to Amarillo, all the way down to Kingsville. And the one in Kingsville is Texas A&M University-College College of Pharmacy. It's the closest in terms of proximity to the Rio Grande Valley, but that's not the only one, all right? This little star right here is important because it describes our affiliation with STC. And what I mean by it's the DHR program that we've established here in the Rio Grande Valley that I'm a part of at the facility at DHR Health. We have 3 faculty members, 1 staff member, and 4 adjunct faculty for the university. And we work out of DHR Health. But we collaborate with STC on this pre-pharmacy cooperative program that's local and it's close to home. And these are for your students that are really, really interested in pharmacy school. Once they leave high school and they're in their first semester at STC, they can apply to pharmacy school. After their first semester, as long as they have less than 45 credit hours completed. They apply, they go through the interview process. As long as they've met, they're enrolled, and they get accepted. Right? We have about 2 or 3 that are in the process right now of going through that. All right? They get accepted, they complete the remainder of their prerequisites, which is in that 2-year period, and they're automatically into pharmacy school. Now, this pharmacy school is directly linked to the University of Houston. That's the school that they go to. All right? That's where they're getting accepted. So keep in mind that this is here local, and we're the resources for you to make that happen for some of your students. These are the pharmacy program structures that are available. Yes?
Going back into that, so once they complete your 2 years, they would have to relocate to Houston?
They will relocate to Houston for 2 years. Their summer, they come back and they do rotations here in the valley of their second year in pharmacy school. They go back for their 3rd year, right? This is the professional program, and we'll kind of talk about that in these slides, these next slides.
Are the schools ranked? Or why do you have the number there like all over in the prior slide?
This one here?
Yeah.
The rankings are based off of research and things of that sort, so there is ranking of abilities for the schools. So that's. She was asking if the schools here, they're all over here in terms of location, but that's not the number of ranking. That's just location, to depict them by location, okay? Definitely not ranked. Now, I can tell you, just from our statistics at the University of Houston, a lot of times they're ranked based off of their passing rate for their licensing exam. I can tell you that the University of Houston has had a 100% passing rate for the last 4 years, okay? So obviously there's some things that you have to look at there. But there was another question here that I was going to. They have to come, the 3rd year will be back in Houston, and then they will return their 4th year to do their experiential here in the Rio Grande Valley. So if they're going out to any of these other pharmacy schools out here, they may not have a chance to get back here their 4th year. They have to do all their 4 years out in the state of Texas. If they go to Houston, they go to Houston for 3, and then they come back for their 4th. Okay? So it kind of saves them 1 year in terms of housing and things of that sort, right? Although tuition would remain the same because you're still in school. So the key program here is the 2-4 program, which is one of the ones that is taken advantage of by our students. And that's students that are trying to complete their prerequisites within a 2-year period and then applying to pharmacy school. Now, keep in mind, all of these programs, if you look at them, they're pretty much all 4-year professional study programs. So your pharmacy degree, your pharmacy curriculum is a 4-year program. What you're cutting here are your undergraduate years, right? So there's accelerated programs that do that, and most colleges of pharmacy will accept you once your prerequisites are completed. So after 2 years of pre-pharmacy courses, once you've met all the prereqs for your school, then you apply to pharmacy school and you get into your pharmacy profession for a total of 6 years. Make sense? That's one program. The other one is a 6 to 8 year program. Very similar. You complete your prereqs, but some will decide to complete their bachelor's degree. And it's just because they're undecided. Some of them are undecided. They don't know what to do. They kind of have different fields that they're choosing. So they'll complete their bachelor's degree, and that's what makes it an 8-year program, because you still have to complete your bachelor's and then complete your professional program. Make sense? Okay. And then the one that I'm talking about here, the one that's local, is actually an accelerated type of program where you actually get accepted within the 2-year period. If you can complete your prereqs within a 1 to 2 year period, if you're taking duly enrolled prereqs already in high school and your students are engaged there already, you can complete them anywhere between 1 to 2 years, and you're already accepted into this U of H program, right? Then you go and you complete your 4 years of pharmacy school. And that could become a 5 or a 6 year program, depending on how fast they can complete their prereqs at STC. Make sense? All right. Any questions there? Okay. So is it right for you? These are just general questions that you can ask your students. Really the key here is, do you like science and math? That's really the key. That's what it's composed of. And when we're looking at competitiveness for the school and for admissions, we're looking at math and science GPAs. And I'll show you the statistics for the University of Houston here in a bit. But that's exactly what we're looking at. Science and math is key. There's some other core curricular courses that we will focus on, Englishes, things like that, for communication, that are hugely important, that you need to ensure that your students are doing well in. All right? But that's the key there. And then when selecting a pharmacy school, I'll really just point out a couple of things here, is looking at an accelerated timeline, right? Looking at what fits for them. What's economically feasible for the student? Can I cut down my courses by taking high school dual enrolled courses, getting some of my prereqs done in high school, getting into my first year of STC or any undergraduate, and trying to get my prereqs done as quickly as possible to get into this 4-year program anywhere in the state? All right? So looking at that, there's also accelerated professional programs where it's not a 4-year Pharm.D school program, it's a 3-year Pharm.D school program. So looking at those particular programs, none in the state here, but there's some out-of-state programs that do have an accelerated 3-year Pharm.D program. How much do you want to pay, in-state or out-of-state? Depending on where you go. You know that tuition is a lot more out-of-state. We have 9 schools in the state. They have plenty to choose from. And as a matter of fact, the schools want your student. So let's try to make them as competitive as possible. And then public schools and private schools are important. Private schools are more costly. At this particular time, the PCATs have kind of been eliminated for most of the schools in the state just because of the pandemic and the situation that we're in now. So the PCAT has been eliminated from the admission process or the accepting process, but the quick answer is yes, normally they do. It's on a temporary hold right now, and they're accepting them without PCATs. You don't have to take the PCAT. Do you want another post-grad degree? So looking at potentially schools that offer a dual degree, a Pharm.D degree along with a master's in business. There's programs that actually offer that. University of Houston has some opportunities there as well. And then just campus life. They got to go and experience it. They got to see the diversity in these campuses to know what type of students they're dealing with, what organizations are available, and what opportunities they have to work in teams, right? That's what we're all about with pharmacy and medicine now and healthcare. We want to work as a team to come together to improve outcomes in our patients. So this is the timeline, and I'll go through it really quickly because I know Dr. Rao's already given me that look. But we'll develop good study habits. This is in middle school. Develop writing skills. Learn to enjoy reading. All of that is important to the progression and matriculation into pharmacy school. High school, what can they do now? Enroll in science and math classes. Make sure their GPAs are really, really good there. Join a health professions or science club, right? Volunteer is important too. Volunteering in the setting. Coming to DHR Health in the summer and working with our pharmacy team and our pharmacy department. Getting onboarded as a volunteer is good experience. Not only do they figure out whether pharmacy's for them, but they actually get to learn a little bit and pad their resume a little bit for application. All right? Learn about the college requirements. That's important. You guys can relay that information to them. Tell them what courses are important. Instruct them on what to focus on if pharmacy is really their career. Instruct them on reaching out to us, their resources, any pharmacist in the community, to gain additional information on it if they really want to get involved in pharmacy. And that's that there. So the key here is there's another component in high school that allows them to take another step, the first step, which is becoming a pharmacy technician. And they can do that in their high school years, okay? As long as they're ready and they're focused on doing that, or maybe they're not. Maybe they just want to try it out and see what pharmacy is all about and figure out whether that career is for them. Have them look at pharmacy tech school and certifications. As a matter of fact, there's a pharmacy tech in training program by the state board that doesn't require them to take any coursework, okay? They take the exam, they study for the exam, they become a pharmacy tech in training, and they can work throughout their high school years as long as they are fulfilling their high school diploma, right, within a 2-year period. So they can start as early as juniors in high school, getting in and working as a pharmacy technician. And believe me, techs to us are really, really important. That is like the stepping stone of getting into pharmacy school, but they do a tremendous job and their roles are expanding.
What resources would they need to be able to challenge that test?
Yeah, there's review resources, there's review coursework, and we can give you links to that as to how to access those, but APHA, ASHP puts out review documents that they can look to review, and it's a lot of science and a lot of math, right? So. And then getting to know your medication names, brand generics, things like that. And then college, the 2 to 4 years that I talked about, whether they do their prereqs in undergrad or they complete their bachelor's degree, that's that 4-year program. All of this should start to be handled here. Complete required pre-pharmacy courses, 25 hours of volunteering. Remember that. It's important for your application process. They have to have some sort of volunteer hours, and I'll go through the details. Take the PCAT. Kind of hashtag there or marked starred because that's eliminated right now from the review process for school, and then apply to pharmacy school at this point, right, to be able to get in, and I'll give you that timeline. Pharmacy school, 4 years, you complete your coursework, complete your training, your rotations down here in the valley if you're at UH-COP, graduate as a Pharm.D, and then you take your licensing exam, okay? This is where the UH-STC Pre-Pharmacy Cooperative Program fits, right here. This is where they would be completing their coursework, already accepted to pharmacy school, and going into pharmacy school. Okay? Any questions there? Yes, ma'am.
And what point do they apply to this?
Yeah, they can apply in as early as their first semester at STC, as long as they do not have more than 45 credit hours completed. Okay? Yeah, they're enrolled in STC, they can apply there, and they go through the entire interview process. Yeah. Certifications, this is just to give you a little bit of post-grad type advanced training, you actually take your exams here. You have a law exam and then your board exam to get licensed. But then you have certifications here that a pharmacist can take, including board certifications that are more specialized, right? So that's advanced training. Yes, ma'am. Into STC? There is no capacity at this point that I'm aware of. Yeah. And normally, believe it or not, it's been a handful of students that have actually accessed that program at this point. So it's something that's available, it's an opportunity, and we'd love to enhance those numbers. So, yes, ma'am.
So you have students that are graduating with, 42 hours of college credit, and some are in college. So what happens to those students? Do they not qualify to go to the STC program?
42, you said? Not, and we have to look at their coursework because they may not all be prerequisites, right? So maybe all of those 42 may not meet the prerequisite coursework, and they would still be able to be available.
But they already have 42, you said they need to have
Less than 45, they would still be eligible.
But let's say they don't have all the prerequisites.
Yeah, and that's the key point there. I want to clarify this. You don't have to have all of your her question was that 42, if they don't have all their prerequisites completed yet, how do they get accepted into this program? That's the beauty of this program. Your prerequisites do not need to be completed. You complete them over the 2 years. You have to get started in the program. You get accepted, and then they follow you for those 2 years to make sure that you complete your prereqs. But you're already accepted into pharmacy school. Yeah. So good question there. Anything else? Okay. Yeah, they have to maintain, good point. She says what credentials and what metrics do they have to meet in order to maintain or remain in the program, and that's ultimately a GPA. So they're looking at your GPA in math and sciences to be above a 3.2, I believe. So you have to maintain a competitive GPA, and they push you and they mentor you and they ensure that they follow you through those 2 years. Okay? And we're liaisons there too, so we help those students along the way. And then advanced training, guys. Residency training, which is post-grad, 2 years. We have a residency program at DHR that kind of integrates with our APHA program, our experiential program, and we get through the interprofessional type of training that they're required. Last part of it. This is the timeline for application, really quick. Applications actually open up July of 2021, prior to the year they're going into school. You can see they're in July of 2021, the application process opens. Classes begin August of 2022. It's actually a whole year, right? So they go through this application process. The application process deadline for submission is May of 2022. Okay? You can take pictures of that one. It's probably easier to follow. And then final deadline for your PCAT, if it's being accepted, is April of 2022, right? Before the deadline of application submission. And then you go through the interview process, etc. And this is the part here that you want to make sure, or they ensure that the student completes all math, science, and all non-math science courses in the summer, all the way through the spring and the summer, making sure that all of the prereqs are completed before they're matriculating into pharmacy school. All right? Prereqs, again, coursework, letters of rec, we talked about that. Get to know a pharmacist. Hours of service, how many hours of service? 25, perfect. Pharmacy college admissions, PCAT, optional for the fall of 2022 and fall of 2023, okay, to address that question. And then this is the math and science coursework here, right? A physics in high school can replace this physics here, but generally it's biologies, micro, chemistry, right? That's ultimately what it is. And then core curriculum, English, history, political science, social and behavioral, language, philosophy, and culture, which are your fine arts, and then etc. So typical core curriculum that we see to move into a healthcare type profession. Letters of recommendation, make sure you know a pharmacist, or a professor or a TA, or any of your supervisors if you have work experience. All right? Then experienced volunteer, make sure that you look into the opportunities with different facilities, different pharmacies. They allow the the students to get in there and work as techs, right? And observe and shadow and do all of that good stuff that they need. These are the statistics again for UH-COP admission. About 125 students accepted every year. Pre-Pharm GPA of 3.4 to 3.5, more or less. It's ranged like that for the last 3 years. And then there's your math and science GPA, ranging between 3 and 3.4. Okay? That's very important. That's what makes them competitive. BS degrees, declining. More students looking for accelerated programs. Finishing their prereqs and then jumping into pharmacy. As you can see, this number decline. So not very many are completing their bachelor's before going into pharmacy as there was before. It's about 50% now. And then minorities. This is the key. Rio Grande Valley, full of minorities, full of Latinx, full of Hispanics. We need them there. 18 out of the 128 in 2021. Right? Very good. And then the pharmacy outlook, guys. Number of jobs in 2020, 322,200. 11,300 openings projected every year. Right? And that increases about 6 to 7% from year to year. If you see, we have 9 pharmacy schools in the state, about 125 students. It's about a little over 10,000 students coming out every year. They're filling these jobs. We need these jobs. And then that's the average salary. That's your ROI. We always look for the ROI. 6 years of school, 8 years of school, that's what they come out earning every year. About $61.88 an hour. Right? Pharmacist employment outlook. This is where they're working. This is the majority right here. Hospitals, pharmacies, and drugstores. And again, multiple levels of opportunities within these settings. Hospital, you have clinical, academics, operations, management. Retail stores, you also have management, you have ambulatory care, you have collaborative practice. So in these settings, in these percentages, you have multiple areas that they can work. This is the trend. When I came out in 2000, I wanted to make sure I grabbed 2000 because that's exactly what I was earning in 2000. And now I'm joking. Now we're right here at 125, 460 in 2020. That's the average salary according to the statistics. All right? When we dig in a little bit closer to home, we look at McAllen, Edinburgh, Mission. Look at that. 147,000 is the average salary in the valley. That just depicts and illustrates the demand that we have in the Rio Grande Valley for pharmacists. It's huge. You can see that the average compared to the state is a lot higher. That means the demand's higher, right? And then pharmacy technicians, guys. This is their average salary per year, about $16.87 per hour. These are the amount of jobs opening up every year, and we need pharmacy technicians really, really bad. This is the website we took that information from. Pharmacy technician training, there really is no experience necessary as long as they have a high school degree, diploma, or equivalent. We do on-the-job training for most of our techs, and they get certified through the state board, right, after they take their exam. And then for pharmacy tech and training, as long as they're pursuing a high school diploma within the 2 years, starting as their junior year, they can become a pharmacy tech and training and get some experience in the pharmacy. Okay? So look at that. Here's a State Board of Pharmacy link for the tech and training applications for them. They need it. And then pros and cons. Sit with your student. Talk about the pros and cons. Customize the pros and cons to them. Ask them the questions that we've placed on the slides. Figure out whether pharmacies for them. Have them come in, do some volunteer work, stuff like that. But work out the pros and cons with them individually and customize those. That's very important. This is our pharmacy team, our management team for the program, for this affiliation. And you can reach out to anybody in our department at DHR Health to obtain additional resources. Okay? And that's another glamour shot that they threw up there. And then this is my contact email and phone number in case anything else is necessary. Okay? You can reach out to me for anything that you may need. Thank you. Appreciate it.